Rather than targeting one area of your body, chemotherapy is a systemic therapy. The drugs you take travel throughout your body, targeting and killing rapidly growing cells.
So chemotherapy can be used for a variety of different reasons. Chemotherapy can be used to try and cure a cancer. We know that some types of cancer, like lymphoma and people who have testicular cancer, can be cured of their disease with chemotherapy. In other circumstances, chemotherapy can be used to increase the chance of cure after an operation. So very commonly for women with early stage breast cancer, most of these women will be advised to have chemotherapy to increase the chance of cure. So that by doing that, the chemotherapy aims to kill off any little dots of cancer that may be left in the body. Likewise, for people with bowel cancer and lung cancer, these people are often also advised to have chemotherapy to increase the chance of cure. Chemotherapy can also be used to try and make radiation work a little bit more effectively. We call that using chemotherapy as a radiosensitizer. And also chemotherapy can be used when cancer cannot be cured. In people with advanced or metastatic cancer, we know that chemotherapy can improve survival, can increase quality of life, and can reduce symptoms. So most chemotherapy is given as an outpatient. Sometimes people do need to be admitted to hospital for chemotherapy, but most commonly it's given as an outpatient. So it involves a visit to a hospital or to a treatment centre and then going home on the same day. Most chemotherapy is given intravenously, so as an injection into a vein, though sometimes chemotherapy can be given as tablets. Most chemotherapy is better tolerated now than it was 10 or 20 years ago, and that's largely because we have much better ways of dealing with nausea, dealing with vomiting, and dealing with other side effects of chemotherapy.